Hi, you guys. Welcome back for our daily practice questions. It is day 117, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states, at what CD4 count should primary prophylaxis against PCP be initiated in an HIV positive patient? So again, at what CD4 count should primary prophylaxis against PCP be initiated in an HIV positive patient? Is it A, below 500? Is it B, below 350 cells? Is it C, below 200 cells? Or is it D, below 100 cells? Take a moment and tell me what you got, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. But here, the stem is the question is the stem. So, at what CD4 count should we initiate primary prophylaxis against PCP, your pneumocystic pneumoniae, right? For HIV positive patients, is simply what it's asking you. And the answer is C. A CD4 count below 200 warrants us starting prophylactic treatment, okay? Question number two. A 40-year-old HIV positive man is diagnosed with PCP. What is the first line treatment for pneumocystic pneumonia? Is it A, azithromycin 500 milligrams daily? Is it B, Bactrim high dose for 21 days? Is it C, fluconazole 200 milligrams daily? Or is it D, INH? Take a moment. Tell me what you got. All right, so stemming the question here, what is the first line treatment for pneumocystic pneumonia? Y'all, PCP, and this is a prime example of why I tell y'all to read the stem. This stem tells us everything we need to know. How do we treat first line for PCP, right? HIV positive patients, pneumocystic pneumonia is a form of pneumonia that they get. Remember, HIV patients are immunocompromised, so we don't need them to have pneumonia, right? So what we're doing is we're going to give prophylactic therapy as well as we treat it immediately, right? So the best treatment for PCP is B, Bactrim, high doses for 21 days. I know there's other therapies that we use, especially for prophylactic therapy, like your Dapsone, but Bactrim is first line, y'all. And when you study, that's why I'm big on making sure that you study in a fashion of the top of your first line list. Make sure you know these. Don't just randomly just know one thing and cap it off of that, because however it's presented to you, you need to be able to pivot so that you are not tripped up in any shape, form, or fashion. So if I'm telling you things, diagnostic exams, I'm always going to tell you the gold standard. If we're talking treatment and it specifically says first line, I'm going to tell you the top of the first line, okay, by guidelines, so that whenever you run into these questions, you will know it from that perspective, because that's what they're looking for, okay? All right, in question number three, what is the primary goal of initiating antiretrovirals in an HIV positive patient? Is it A, to prevent opportunistic infections? Is it B, to increase CD4 cell counts above 500? Is it C, to achieve and maintain an undetectable viral load? Or is it D, to avoid the need for lifelong medications? Take a moment and tell me what you got, y'all. All right, so stem of the question here. STEM is the question is a STEM, right? So what is the primary goal of initiating an antiretroviral for HIV positive patients? And your best answer is C. We're trying to achieve and maintain an undetectable viral load, right? These patients are immunocompromised, and when the viral load is undetectable, so basically non-existent. So um, when we can achieve that range as well as maintain that range, it aids in improving the immune function because they're immunocompromised. So with this, their immune system is pretty much normalized, as well as it helps to reduce the level of transmission. So this is the goal of these antiretrovirals. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. Subscribing helps you to get notifications for each of my daily videos and any of my shorts or things that I may be giving for topics and tips to help you in boards as well as in practice. But as always, y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to thenursinstudio, the number one, at gmail.com. Everything that I do offer is linked in the bio of this channel. And as always, if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, or any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.